In this podcast episode, Dr. Charan Ranganath, a leading expert in the fields of memory, cognition, and neurobiology, explores the intricate relationship between these domains. He delves into topics such as memory retrieval, the role of dopamine and curiosity in learning, the impact of aging on cognitive function, and the effects of lifestyle factors on brain health, while also discussing the significance of self-representation and the influence of technology on memory formation. Ranganath delves into the complex interplay between memory, cognition, and the brain's neurobiology, emphasizing that memory is not merely a repository of past experiences, but is fundamentally about the present and future. Memory enables individuals to draw from past experiences, to make sense of current situations, and anticipate future events, shaping our understanding of ourselves and our interactions with the world. Ranganath explains that disorientation upon waking or after a nap often stems from the need for active episodic memory retrieval. This retrieval process can be slow and foggy, particularly when transitioning from sleep, as the brain is still in a state of low neuromodulatory activity. Individuals with memory disorders struggle with this retrieval process, leading to confusion about their surroundings and identity. This highlights the critical role of memory in maintaining a coherent sense of self. The conversation shifts to the relationship between self and memory. Ranganath points out that even individuals with severe memory deficits retain a stable sense of self. While they may struggle to update their memories effectively, they still possess a fundamental understanding of who they are. This stability in self-representation is crucial for navigating life, even in the face of memory challenges. Ranganath discusses the role of curiosity in enhancing memory and learning. He cites a study where curiosity about trivia questions led to increased dopamine activity in the brain, facilitating better memory for related information. This suggests that curiosity not only drives engagement with new information, but also primes the brain for learning. Ranganath emphasizes that curiosity can be cultivated and is essential for maintaining cognitive flexibility and openness to new experiences. The conversation delves into dopamine's multifaceted role in the brain. Ranganath explains that dopamine is not solely about pleasure or reward. It also plays a critical role in motivation, learning, and cognitive movement. Dopamine energizes individuals to seek rewards and information, which is essential for both physical and cognitive movement. This connection underscores the importance of being open to new experiences and challenges. Ranganath addresses the potential for individuals, particularly those with ADHD, to become entrenched in specific behaviors or interests due to the dopamine-driven nature of their curiosity. While individuals with ADHD can focus intensely on topics they find engaging, it is crucial to diversify the sources of dopamine stimulation to promote a well-rounded approach to learning and engagement with the world. The importance of appraisal processes in curiosity is another focal point of the discussion. Ranganath explains that how individuals interpret their environment, whether they find something interesting, important, or threatening, affects their curiosity and engagement. Cultivating a mindset that embraces curiosity and novelty can enhance cognitive flexibility and promote lifelong learning. Ranganath outlines the key brain regions involved in memory, including the hippocampus and prefrontal cortex. The hippocampus is crucial for linking experiences to specific contexts, allowing for the formation of episodic memories. In contrast, the prefrontal cortex is involved in higher-order cognitive functions, such as decision-making and planning. Together, these regions create a cohesive understanding of past experiences, inform present actions, and guide future behavior. The discussion centers around the intricate relationship between memory, the prefrontal cortex, aging, and lifestyle factors that can mitigate cognitive decline. Ranganath emphasizes the role of the hippocampus in memory formation, highlighting its importance in encoding and retrieving information. While the hippocampus is crucial for memory, the prefrontal cortex plays a significant role in cognitive control, essential for regulating thoughts and actions based on higher-order goals. Ranganath explains that the prefrontal cortex is a large and complex area of the brain responsible for cognitive control, allowing individuals to focus on what is important despite distractions. He shares insights from studies involving patients with prefrontal lesions, illustrating how these individuals struggle with tasks requiring sustained attention and adaptability. For instance, during the Wisconsin card sorting test, patients with prefrontal damage may continue to apply an outdated rule even when it no longer works, demonstrating a failure in cognitive flexibility and control. The conversation shifts to aging and its impact on memory and cognitive function. Ranganath discusses how older adults often perform poorly on memory tests, particularly those requiring focused attention. However, he cites research indicating that older adults can remember information they are not supposed to focus on just as well as younger individuals. This suggests that the decline in memory performance may be more related to the ability to filter out distractions rather than a complete loss of memory capacity. Ranganath highlights the importance of lifestyle factors in minimizing age-related cognitive decline. He references a study involving 29,000 participants that identified 6 key lifestyle factors: engagement in cognitive activities, social engagement, physical exercise, not smoking, moderate alcohol consumption, and maintaining a healthy diet. Those who adhered to 4 to 6 of these factors showed significantly better memory performance over 10 years compared to those who followed 0 to 1. Exercise is particularly emphasized as a critical component for maintaining brain health. Ranganath notes that cardiovascular exercise is especially beneficial for enhancing blood flow to the brain, supporting cognitive function. He shares his personal experience of incorporating regular exercise into his routine, including walking his dog and working with a personal trainer to improve both physical and mental well-being. The discussion also touches on the impact of depression on memory and cognitive function. Ranganath explains that depression can lead to cognitive impairments, including difficulties with attention and motivation. Individuals with depression often experience rumination, hindering their ability to focus on positive experiences and memories. This highlights the importance of addressing mental health as part of a comprehensive approach to maintaining cognitive function. Ranganath introduces the concept of sense of purpose as a vital factor in cognitive health. He explains that having a clear sense of purpose can motivate individuals to engage in activities that promote brain health, such as exercise and social interaction. He shares his own journey of rediscovering purpose after completing his book, emphasizing the importance of connecting daily activities to personal values and goals. Ranganath discusses several key concepts related to memory, attention, and the impact of technology on cognitive processes. He explains that forgetting often occurs due to the lack of distinctive memories. When we engage in conversations or experiences, our memories can become blurry if we do not focus on the unique aspects of those moments. He emphasizes the importance of intention in memory formation, suggesting that when we are fully present and engaged, we are more likely to create strong, cohesive memories. Conversely, distractions can lead to fragmented memories, making it harder to recall specific details later. Ranganath highlights the detrimental effects of smartphones and task switching on cognitive control and memory. He describes how frequent interruptions from notifications can shift our attention away from meaningful conversations or tasks, leading to a decline in cognitive performance. Each time we switch tasks, there is a cognitive cost, making it harder to return to the original task and increasing the likelihood of forgetting. This is particularly problematic for individuals with ADHD, who may struggle to maintain focus in the face of distractions. Ranganath advocates for creating an environment that minimizes distractions, such as using focus mode on smartphones, to enhance memory and cognitive performance. The discussion shifts to the role of photography in memory formation. Ranganath explains that while taking pictures can seem like a way to enhance memory, it can actually impoverish our recollection of experiences if done mindlessly. He emphasizes the importance of intentionality when taking photos, suggesting that capturing meaningful moments can serve as effective retrieval cues for memories. However, mindlessly snapping pictures can lead to a focus on the act of photographing rather than the experience itself, resulting in a lack of emotional connection to the memory. Ranganath encourages mindful photography, where individuals take the time to reflect on the significance of the moment, thereby enhancing their memory of the experience. Ranganath discusses the relationship between deep focus and dopamine release. He explains that achieving a state of deep focus can enhance dopamine levels, which in turn supports cognitive performance and memory retention. The prefrontal cortex plays a crucial role in regulating attention and modulating dopamine activity. When individuals engage in focused tasks, they can experience a sense of satisfaction and accomplishment, reinforcing their motivation to maintain that focus. Ranganath suggests that cultivating environments that promote deep focus can lead to improved cognitive outcomes and overall well-being. Ranganath emphasizes the importance of sensory health in relation to cognitive aging and Alzheimer's disease. He discusses research indicating that untreated hearing loss and vision problems can significantly increase the risk of cognitive decline. Additionally, maintaining good oral hygiene is linked to better brain health, as gum disease has been associated with an increased risk of Alzheimer's. Ranganath highlights the need for preventative measures, such as regular hearing and vision screenings, to mitigate these risks. He also mentions the role of inflammation in cognitive decline, noting that lifestyle factors such as diet, exercise, and sleep can help reduce inflammation and promote brain health. The conversation concludes with an exploration of déjà vu. Ranganath explains that déjà vu is not fully understood, but is thought to involve a mismatch between familiarity and recollection. He references research showing that individuals with temporal lobe epilepsy often experience intense feelings of déjà vu before seizures, suggesting a neurological basis for the phenomenon. Ranganath discusses how familiarity is processed in the brain, particularly in the perirhinal cortex, and how this area interacts with the hippocampus. He describes experiments that demonstrate how familiarity can be triggered in virtual environments, leading to feelings of déjà vu when individuals encounter similar contexts. This highlights the complex interplay between memory, context, and perception in shaping our experiences of familiarity. Ranganath highlights the role of serotonin in memory and emotional regulation. He explains that serotonin can influence how memories are encoded and retrieved, particularly in the context of trauma. When individuals experience trauma, their memories can become distorted or overly negative, leading to a cycle of rumination. Ranganath emphasizes the importance of reframing these memories, suggesting that changing the narrative around traumatic experiences can help individuals process and integrate them more effectively. This reframing can involve viewing the memory from a different perspective, which can alter the emotional weight associated with it. The conversation shifts to the effects of psychedelics on neuroplasticity and memory. Ranganath discusses how psychedelics can enhance neuroplasticity, creating opportunities for learning and memory updating. He points out that while the experience of taking psychedelics can be profound, the real learning often occurs during the integration phase, where individuals work with therapists to make sense of their experiences. He emphasizes that the guidance of trained professionals is essential to ensure that the integration process is beneficial and does not lead to further trauma. Ranganath also discusses the dissociative effects of psychedelics, which can lead to significant perspective shifts. He explains that changing one's perspective can dramatically alter the way memories are recalled and understood. For instance, viewing a traumatic memory from an outsider's perspective can reduce its emotional intensity and allow for a more objective analysis of the event. He references research showing that when memories are retrieved, they become malleable and can be reshaped, which opens the door for therapeutic interventions that can help individuals process their past more constructively. Additionally, Ranganath shares insights from his experiences in group therapy, particularly with Vietnam veterans. He notes that sharing stories in a supportive environment can lead to collective memory formation, where individuals can recontextualize their experiences through the reflections and reactions of others. This communal aspect of storytelling can facilitate healing and provide new narratives that help individuals cope with their trauma. Ranganath delves into the concepts of rumination and nostalgia, discussing how both can impact mental health. He explains that while nostalgia can have positive effects, such as fostering a sense of connection and gratitude, it can also become toxic if individuals dwell too much on the past in a negative light. He emphasizes that the narratives we construct around our memories play a significant role in shaping our emotional well-being. He warns against the dangers of story fondling, where individuals may inadvertently amplify the negativity of their experiences by repeatedly recounting them in a way that reinforces their trauma. This can lead to a cycle of negative emotions and further entrench the traumatic memory. Ranganath stresses the importance of balancing the acknowledgement of past pain with the recognition of positive experiences, as both are integral to a holistic understanding of one's life narrative.